Hi guys, Dr. Dilip here, your internal medicine faculty at Cerebellum. Today, I'm proud to introduce Dr. Suprabha, who scored a very good rank of 1283 in the recent INA exam. And welcome, Dr. Suprabha.
Thank you, sir. Good evening, sir.
And I think you're kind of a topper in NEET PG also.
Yes, sir. I got a decent rank.
Yeah, and you've been consistently scoring good ranks over the last 2, 3 exams, I guess. So previously, I mean, every student to begin with, they're not going to score a good rank. So with repeated exams, they're going to score good ranks.
Yes, sir.
So what made you get a better rank? Because each and every single topper will have a different story. So what is your take about like why did you get that improvement in the ranks? Why did you get that jump in the ranks?
Sir, it started with my first attempt was last year to the May exam, in which I was getting 22,000, and still I was getting IP seats. So at that time, I thought that these ranks are not deserving for the seat, even if I get through the IP. And I was not at that level, so I thought of trying again and give my best. So I tried, and last November I got a rank of 1700, and still I did not get anything with that rank, and I tried again. It came 1900, still stuck at that level, and then NEET happened. I got a decent rank, I get a seat with that, but still I tried this November, giving my last attempt, thinking that I may like jump into the under 1,000 or like in the good ranks, but it could not
It needs a lot of
happen.
motivation, right, to study. I mean, you know that you're going to get a good seat in NEET exam. And again,
Yes.
to write an INA exam, I mean, it needs a good bit of motivation. And many people
Yes.
can't do that.
Yes, sir, it was very difficult for me also, and I can say that I did not put that much of effort after NEET, because anyway, when you think that you have a seat in hand, it becomes difficult to put that much effort. So that is the thing. But that cerebellum END and BTR schedule really helped me to stay focused on that. So even though I was not reading everything, but still I used to give every single test of cerebellum END and BTR test. So that was the thing that made me on track, like kept me on track till the exam. That was the thing.
How did you handle the topics that you're struggling? I mean, because each and every student will be struggling with certain bit of topics. And whatever topics that you have been struggling with consistently, how did you
Yes.
handle them?
So like basically the first and second year subjects where I was like struggling basically with pathology and all. So I went to the Q banks, I solved them, and that was the point wherever I was thinking that this is not like whatever I am reading is not being applied in the manner I want. So I did the Q bank for that subject, particular subject, and that really helped me.
Okay. So you know that mentorship nowadays plays a huge role.
Yes, sir,
So
definitely.
what role did mentorship? And it can be anyone. So it can be your faculties, it can be your seniors, it can be your friends, it can be your parents also in some
Yes.
instances. So how
For
did mentorship play a role in your success?
So for me, my parents have been very supportive all throughout this year, though they were always telling me to get a seat like in whatever decent branch I'm getting, but they were always supportive that you can try. If you think that you have the ability to try again, then you can try. And the constant motivation, like the Cerebellum Academy faculties have always been there on the groups, as you can see, like if we have any query, they will just answer it, and like the kind of efforts that the faculties put here, we can also give our best, like we can also put the same level of efforts. So I thought that that was the thing that motivated me, and especially Praveen sir always tells that you should like try, give, you should not. His motivation was like a very good.
You should take preparation till the last day. That's what he keeps
Yes,
telling.
sir. Yes, sir. And that really matters, like people get off track before exam because I was doing well till the September end, but I got off track in October, like after I got a fracture in my leg.
Oh,
So it
so that's
happened.
that's the question I was about to ask next. So I was trying to ask about the setback or the lowest point of your preparation and how did you tackle that? So I think you said the answer already.
Yes,
So maybe your setback, I think the lowest point must be the fracture that you've been talking about
so
during
it
your preparation
happened the
journey.
last month only, so it was really struggling, like if we are struggling even to do the daily deeds, then how to focus? It was really a problem.
Each and every student, if you ask them, they're going to have something, right? So some low point, and it's all about like getting and bouncing back,
Yes, sir.
getting back again there.
Yes, sir.
So do you think is there any common misconception that's circulating among the students about INICET?
Sir, it is a thing that we should go all out in. You can get and you cannot get, but you should definitely try. It is not something that cannot be cracked. I have seen many of my juniors also, because I am from 2018 batch. 2019 batch has done really great results. So anyone who studies properly for 6 months, they can crack it.
Okay,
For
so your time frame is 6 months.
Yes, sir. I have seen many of my batchmates also have done it, and what I think you should target the right exam. The problem with me was I was thinking that I know and I can do it in 2 months, and I did not spend the proper 6 months when you go from the basics till the end, doing all the labs as we do in the mission. So I did not properly follow. Still, I used to listen lectures, do ENDs, but not the way it should have been. So that is the thing, that we should target the right exam. We should accept what we are at, at which level we are, and then we should target. So that
Okay.
was the thing.
I want to ask about the genuine feedback about the grand tests of Cerebellum. So, we started with the INICET GTs and mocks as well in the last month. The
Yes.
last three GTs were actually supposed to be for INICET. So, how did you feel the grand test? Like, was the grand test useful, or they were mimicking the real exam in many ways?
Yes, sir. I will tell that cerebellum GTs are very much close to the real exams, and it gives a all mix of kind of questions, not so tough, not so easy, but a balanced manner, which can trick you, but you can get through the question if you are really reading well. So I think they are very good. I have done GTs from all the platforms, so we can see the frame of questions in which cerebellum asks. It seems difficult in the as we read, but it is not so, and it includes everything like the standard what it should have. So I think it is very close to the close exams, real exams.
Okay. So, every student during the exam faces dilemmas while choosing an option, right? So each and everyone has their own strategy. So this is something that I used to ask to all the candidates. So whoever I've been interviewing. So how you're going to eliminate choices? I mean, suppose if you don't know a question. So if you're facing dilemmas during the time you're choosing an option, how did you tackle that scenario?
Yes, sir. In that case, any question, many of the teachers have told, just if even if you know one single option and you're very much sure about it, just revolve around that, remove that, and make
So you are
it.
saying go with the instinct.
Yes, sir, definitely. We need in INA, we definitely have to take guesses and we have to attempt more. So we should go with the instincts, and we should attempt even if we know one of the single options, we can try attempting.
Yeah, and another important thing is you have been a consistent student in the mission plan, and you've been attending almost all the classes, with a few exceptions, of course. But the resources are overwhelming, right? So everywhere you go out, there are too much of resources, overwhelming resources everywhere. It's how will you really streamline those resources and how you make the best use of them?
Sir, so I have made one thing, BTR was there. I have been following BTR. That was my base. I have added mission onto it. So I have been listening and I have annotated or written all the points on BTR itself, and have aligned cerebellum with BTR. That was the only thing I did. And whatever GTs I used to do, I used to write all the extra points on that only. So that was how I consolidated my resource, and I used to read that only for any kind of test or GT. So
Excellent.
that was a combo.
Now, a question outside academics. What kind of habits in your life did you feel that were rewarding when it comes to your rank?
So waking up early, and that was the thing.
Those are very typical. a candidate? I mean, you wanted to wake up early and you want to end up the day early.
Yes, like I used to sleep by 12 only, but I have like seen that if I
12, come
start,
on, 12 is something that becomes so common in medicos. Like that's
yes, sir.
when you speak to any medico, they say like 12 is early. I mean, you can't see a single medico sleeping before 11 or 10:30.
Yes, sir. So for me, the thing was like if I start my day by 9, I would not feel so much like I have done much in
So
the
your day
day.
starts by 9, okay? So you consider
No,
that.
sir, starts by 6. So
Okay, okay,
like
okay. Great, great, great. I mean, anyway, that's early. Yeah, that's early.
if I start by 9, and so I used to feel that I am wasting more time.
Mhm.
That was not much
No, that's a
of
true thing. In fact, like when you start the day early, it seems like you have a lot of time in the day.
yes, sir.
If you start the day late, it seems like you hit the night faster,
Yes,
and
sir.
will always be in an apprehension that your day is already gone.
Yes, sir.
When you go to like
So
7 o'clock, 8 o'clock, by the time you go 7 o'clock, 8 o'clock, you feel like your day is already done.
yes, sir. That's the thing. So that is what like if I used to wake up early, so I had time in my hand to do many things, and that was the thing.
So you said 6 months is ideal. So for a candidate who wants to start from scratch
Yes,
and
sir.
is aspiring for INICET, what is the ideal time frame you think is enough?
If starting from the like base, they
Base,
may
yeah,
take
starting from scratch. We'll go, I
6.
mean, we'll divide into two. Okay. So starting from scratch, and for some students who have already done a decent base during their internship. So starting from scratch, how long it will take?
It may take 6 to 9 months. Maybe like my certain juniors, they have started from base. So I have told them to target May, like 2016 May. So those who are scoring like 70 or 80 in the GTs right now, they cannot. He asked me in August, so they cannot do 140, 150 in two
Hmm.
months. So they should target for me. So the time frame can vary from 6 to 9 months. That can be true for those who are starting from the base and those who are doing a decent rank like GT score of 100 or 120. They can do the wonders in those 6 months. So
Fantastic. Fantastic. So you say like people who have already had a base, 6 months is more than enough.
yes, sir.
People who are
But
starting from scratch, somewhere around 9 months to 12 months will be enough,
yes, sir.
mostly.
Like,
Okay.
for them, it should be consistent also, and they should have a proper guidance also in that 6 months. That is also there.
Okay. So I mean, you said like you wanted to become an logician or probably a surgeon. So what inspired you to become a surgeon or a logician?
So during my internship days, the only thing I liked was I have spent most of the time in the surgery ward doing dressings and all that, being part of that. The kind of gratitude and the satisfaction you get, like what I liked the most was I have done dressings as an intern and seeing that heal in front of you, people getting better and like they have a feeling of happiness and I can feel whatever I'm doing, it is showing up to me. So that was the thing I feel satisfied by that. And being magician is also another way of happiness where you are like helping the mother, like being with the baby at the end. So that is another thing. I am thinking of OBG because of surgical and medicine mix. So that is the only thing.
Okay. Who are your favorite faculties at Cerebellum?
So first and foremost, Praveen sir, Zainab ma'am,
Okay.
Govind Garg sir, Sparsh sir, Vivek sir, and you as well. And Anand sir also has been like a great
Okay.
teacher.
So, I mean, it's not a mandate that you should include me just because I'm taking an
No,
intern.
sir, I have actually seen your like medicine in a like day. Like Praveen sir have told that that is the need, and like your like before that, I have been very scared, like scared of medicine. Like that's my weakest subject, if I have to say. But after watching you, like you tell that this can be done. You can like answer the question. You just have to think logically, like in the basic sense you can tackle it. So like that way of thinking, that way of learning as well, how to, you have even presented like cases, you talk about cases in the class, so the way you approach that is also I learned from you. So that was a different thing.
Okay. So, because you said about medicine in a day, um, did you feel that it did cover almost all the important aspects of medicine? So, that is going to be helpful in any competitive exam right now?
Definitely, sir. More than enough, I will say. If any person do it properly, that whole thing, it's more than enough.
Yeah, so
It
that's the
covers
whole
many
purpose
things.
of doing that medicine a day, in fact. So we wanted to be sure that students study medicine.
Yes, sir.
Most of the students ignore this vital subject. So medicine is such a vital subject that's going to make you think logically in the exam.
Yes,
So if you don't study medicine, say you might still answer question, but you'll be losing out on a lot of simple questions.
yes, sir.
Once you study medicine, you will start feeling like these questions are so simple and logical.
Yes, sir.
Medicine today is like kind of a humble attempt to just to make sure that students read medicine. And I mean, because the only fear about medicine is like how long it's going to take to complete.
True, sir.
Yeah, because everyone feels like it's going to take eternity. It's going to
Yes,
take 15 days, 30 days, still we are not able to complete medicine and how to retain those information.
yes, sir.
So that's the whole idea. So we have worked a lot on it. So almost like I worked for 1 month, 1.5 months to complete that whatever 100 slides or 120 slides that's supposed to be, and we have compiled it. And we wanted to make sure that the students start believing that we can do it in 3 days, we can do it in
Yes,
4 days, and still we can retain that information. Still we can reproduce that information in the exam, and it still will come in the exam. The same topics. That's the whole
yes,
idea. Anyways, and now it's time for rapid fire. Are you ready for the rapid fire? So good
yes,
at
sir.
it.
Yes, sir.
Okay, what's your favorite study snack?
Maggie.
Okay, so Maggie. So most challenging subject,
Medicine.
medicine. Okay, the subject that you absolutely hate the most.
Biochemistry.
For most of them, yes. But I think Ankur sir and Smiley ma'am would have made it easy. Okay,
Yes, sir. It is easier, but it is still like
yeah.
difficult.
The subject that you love the most,
OBG.
OBG. The subject you feel the questions are always tricky.
For me,
No matter how much you read, like you still get it wrong.
medicine.
Medicine again. Okay. Yes, because the cerebellum GTs are also supposed to be a bit tough.
Yes, sir. They are.
Yeah. The biggest source of motivation.
My mother.
Excellent. So one aspect of cerebellum you loved the most.
So the readiness towards the students, like they have been always consistent towards all the needs of the students, whatever they ask, and they have been there always for any kind of need. Medical, be it the studies, be it motivation, everything. You get a combo pack with Cerebral. I really find it as a family. I started with last year and it is.
We are honored. Thank you so much. And one thing in the app, one feature of the app that you like the most.
So the recent update in the beta version, the QBank analytics and the QBank analysis I like the most. The everything, all the how much improvement, accuracy, and everything with each subject, and even the GT analysis have changed. So especially the QBank analysis and then GT camp is also a very nice thing.
If you want to just give one quick tip for time management, what it will be?
Put a timer in your head.
Time
Attempt.
management. Pardon?
Yes,
Timer in your head. Okay. So because like now it's in blocks, right? Almost
yes,
all
sir.
the exams are in blocks now. So students struggle to complete each and every block on time.
Yes, sir.
So
Even,
just one
even
quick
when studying also it happens like we think of completing in 2 hours, we take 4 hours. That also just
okay.
stick
So
to
keep the
that.
timer in your head.
Yes, sir.
So that's what your strategy is. Okay, one final rapid fire question. So when the result came, let it be NEET or INI. So what's the immediate thing that you did?
The thing was, I was not so happy because I expected better. But yes, it was a decent rank, and I really later on I accepted the
Okay,
result.
you are trying
I
to
was,
tell it's mixed emotions.
yes, sir.
So you're stuck in between good and bad.
Yes, sir. It was between
But trust me, it's a
between,
good
but
rank. It's a
it's
good
like
rank. You work well. And see, it's not only about people who have been consistently doing since the like last 5 years or 6 years. So we also worry about people and we also care about people who are doing, who wanted to do best.
yes,
So we cannot keep on talking about the lost time, right? So whatever time has been lost, it's lost already.
sir.
And that's what like we keep talking in Cerebellum, so that we wanted to help the students who wanted to do well, who want to do well, at least from that point of time. So let it be 6 months, or let it be 8 months, or let it be 10 months. We wanted to tell them that still you can do it and you have got it.
Yes, sir.
And so we are absolutely fine. So, I mean, whatever rank the student gets, as long as they're happy with it, we are absolutely fine. So I mean, that's the reason we keep telling the students also, like, so we always, put the people under something called average rank sometimes,
Yes, sir.
but it's not average. You don't know the struggle behind what they have gone through during that phase
Yes.
of preparation. They could have gone through a lot of setbacks. They would have been like lost a lot of time because of so many issues, and still they would have struggled a lot to come up with that rank. So it's very good.
Yes, sir.
That's absolutely fine. Ultimately, nobody is going to remember your rank.
Yes, sir.
Yes. So whether you're going to become a good logician or not, what matters?
Yes, sir.
So you might get whatever rank you're supposed to get right now, and still you might make a great logician.
Yes, sir. Like it is for a time period when you feel bad, but later it's all just a past thing. You should move
Yeah.
forward.
And I'm sure that you're going to become a great logician in the future, and people
We
are
do.
going to love you.
We should give our best, sir, in whatever we get. So I am content now. Like I have been struggling like last year, but not now. I have given my best. I have given all the time
That's the
and
spirit,
effort.
man. That's the spirit.
Yes, sir.
And wishing you all the very best. We are so happy on behalf of Cerebellum.
Thank you, sir.
See you soon. Thank you so much. And yeah, we'll be meeting in Cerebellum soon.
Yes, sir. Definitely.
Yeah. Bye bye. Take care.
That's nice, sir.